AskReddit. Doctors, what's it like when you get sick? Do you go to the doctor or diagnose yourself? Part 2. My family is full of doctors. My dad has gone to work with gastro and a bucket, initially refused to go to the hospital when he thought he was having a heart attack. When he finally did go, he took his laptop and the nurses couldn't get him to stop working. He ignored all his own knowledge about letting a broken bone or torn muscle heal before doing physical work. Doctors do make the worst patients. My dad is a surgeon and a few years ago was diagnosed with chronic lymphatic leukemia and ordered to have an urgent splendectomy. His spleen was 8.5 pounds and pushing on his lungs. He had convinced himself that the pain, fatigue, and trouble breathing was just flu that had turned into pneumonia. One of his doctor friends looked at his chest x-ray and read him the riot act, and only then did he accept that he wasn't going home that night. They really are terrible patients. He's doing great now despite his best efforts. Okay, so my dad is a doctor, and one time when I was around 7, he fell out of a tree directly onto a rock while we were camping, and he had a giant scrape on his side. He told us he was okay and nothing was wrong, so we left as planned and canoed back to our car without incident, besides my mom constantly telling him to stop paddling because of his side, and him telling her everything was fine. He basically just said it was a scrape and nothing was wrong. About a week later, he was having trouble breathing, and he still wouldn't go to see a doctor because he self-diagnosed that he was okay, so mom had to force him to go to the hospital and get an x-ray. Turns out he had 2 broken ribs, so not only do doctors self-diagnose themselves, they're also pretty dumb when they're doing it. My dad's a doctor idiot, and he wrongly self-diagnoses himself all the time because he thinks he's immortal or something. In his defense, the treatment for non-displaced rib fractures is essentially nothing. As long as he had a normal oxygen saturation, he probably knew it wasn't anything too serious. Pneumothorax. Yeah, all it did, if I remember correctly, was he wasn't allowed to go to work and had to lie down. I don't think it affected him. One of the reasons we are advised, if any other doctor comes to you for help, you'd better give him priority, is that he try to treat himself for a while and he wouldn't come to you if it wasn't really serious. Doctor here. I will diagnose myself and write scripts, or as a partner for things like flu, tendinitis, etc. I will go to a derm friend every 6 to 12 months for a mole check. Other big things I'll ask friends I trust who are doctors. The major problem this question leads to, but may not ask, is, do you call in sick when you're a doctor? In 9 years of private practice, I haven't missed a day despite being sick. There was an article a few years ago that labeled it a presenteeism instead of an absenteeism. It's showing up when you shouldn't. Personally, I don't want to inconceive people who have missed work or waited on a result, and I don't want to dump on my partners. Lots of hand washing and apologies for staying far back during conversations. I'm the audiologist at an ENT office. There are 2 more audiologists that work at our subdivision hearing aid clinic. I do everything in my power to avoid calling out sick because I know that A, they hate covering the ENT schedule, and B, their patients will have to be rescheduled. Everyone is inconvenienced and we lose money. However, as an audiologist, if I'm sick that I can't talk, there's little point to me doing my job. I've called in sick 4 times in the past 2+ years. I had a horrible cold, 1 sick day that improved. I went on vacation, and when I came back it reared up again, another sick day. I also had strep throat earlier this year, so had to take 2 days for antibiotics to fully kick in. Since I picked them up in the afternoon, the throat pain waking me up from a dead sleep was a big clue for that one. Middle-aged doctor here. Most of the docs I worked with are obsessed with preventive care, so we try to keep the cardiovascular risk factors under control. We take our blood pressure drugs, our statins, and our metformin, if we need it. We're not perfect, especially me, but we tend to exercise and we watch what we eat. I know one doctor who still smokes, but he's a rarity, and he's practically a tourist attraction, like a 2-headed calf in a village museum or something. The observation is probably correct that when doctors have a symptom, we tend to downplay or ignore it. And I believe we tend to decline therapy. I have a couple of minor orthopedic ailments that my doctor has suggested I have fixed. I laugh. I've known a couple of docs who decline treatment for cancer. I did that for years. Turned out the period pain was severe endometriosis and hip pain from running hip dysplasia, and I needed a replacement. Learn not to do that the hard way. I was a resident, time poor, and thought, at this age, It can't be anything serious. Wife is a doctor in Canada. She works in a small practice with 5 doctors. One of them is her family physician that she will see with an official appointment, seeing as a patient and not a colleague. Everything is documented in the ERM software. If she gets sick, you power through the day and you see your patients. You can't just call in sick as you have 20 to 30 patients booked and no one to cover for you. You don't get time off or sick leave. She then comes home and does charting for a couple hours and dies in bed and does it all over again the next morning. Doctors cannot afford to be sick, financially or for their patients that will be pissed if you rebook their appointments last minute. I always hear in Canada that there is a shortage of doctors, not enough specialists. Why don't the Doctors' Council force the government to increase the number of medical seats at university? It costs a lot of money to train physicians in residency. They don't have the money, staff, resources to increase. Canada also needs to get physicians in rural areas, which is very hard. Everyone wants to work Vancouver, Toronto, big cities. Canada needs to give physicians, family doctors, benefits or pay more. Allow them to have a work-life balance. During my last year of medical school, I woke up in the middle of the night the day before an interview for residency with terrible stomach pain that had radiated to the right lower quadrant. I went to my roommate, also in med school at the time, and he did a physical exam and we both agreed I had appendicitis. Told the ED triage nurse and underwent an operation 6 hours later. Haha. Emergency doctor here. My specialty means I'm usually thinking in the worst case scenario or what can't I miss when I'm seeing patients. I usually end up thinking along similar lines when it's myself as well. Things like, could I have a lower respiratory tract or do I have pneumonia? It's probably the former, and if it's the latter, I'll get worse and I can go see someone for antibiotics later on, or go to ED if I'm persistently tachycardic, tachyphonic, or febrile with rigors, etc. In the meantime, I'll feel sorry for myself and watch Netflix on the couch. I also think about what the actual management would be if I had the illness that I might be worried about in the first place. For example, I had a nasty fall onto my flex knee the other day and it was exquisitely tender. I was almost sure it was just a bad bruise, but I knew if I did have a fracture, it would probably be for conservative, non-operative management anyway, so I just limped around for a week or so. I agree. As an ex-Army medic and emergency medical technician, a friend of mine is enduring med school right now, and her husband has taken the opportunity to engage in some student-level nosophobia. I told her to say, when he woke up with a cough and complaining he couldn't breathe, that she'd been looking forward to practicing with a chest tube in the field. Emergency medicine. It's our job to keep you alive, not to make you feel any better about being alive. I have on many occasions used online resources to help decide if my symptom is worth seeing a specialist for or escalating. Not WebMD, obviously. Use UpToDate or PubMed. If it's something serious that I can't deal with myself, either with time or over-the-counter medication, I would definitely see my general physician, either for treatment or specialist referral. I basically just become a regular patient, but with an insider perspective on the system and some preformed opinions on my own diagnosis. Currently, I'm dealing with annoying palpitations. Got an ECG at work, which showed frequent ectopics. At the moment, I'm sitting on it debating if I should bother seeing a cardiologist or if it will just disappear since most cases are completely benign and self-limiting. In terms of prescription, I would never prescribe myself new medication for acute illness. I only self-prescribe to renew old scripts that I can't be bothered getting. The worst thing is getting medical certificates for work, since I can't write them myself, and it's a huge waste of everyone's time just to get a piece of paper saying I have the flu. It depends on what you mean by get sick. I'm certainly not going to see another doctor if I have a cold, but if I have appendicitis or a lymphoma, I wouldn't have much choice, would I? If it's only a matter of a diagnosis or a simple treatment, then no, I won't bother a colleague. But if I need specialized treatment that I couldn't possibly provide to myself, then obviously. If you have an infection that you think is bacterial, not viral, like there's a lot between a cold and lymphoma. I run the lab at the hospital, so I can usually scam a rapid strep or flu test on myself. Last flu season, I spiked a fever with shaking chills at work. 20 minutes later, I was positive for flu B. The result was in the EMR, so I called my PCP, a colleague, and said I need Tamiflu. She saw the positive result and sent the script electronically to my pharmacy. I'm a nurse, and my parents were also. My dad traumatically lost half of his pinky finger when he got a wire caught under his bush hog on his day off. Being stubborn, he wouldn't go to the ER. He had a buddy x-ray it when he got to work that night and showed the results to the hospitalist when he made rounds. Hospitalist suggested he see his doctor for an ortho referral to remove the exposed bone fragment. My dad refused. Instead, he gathered every antibiotic he could find at his house and started his own course. As the skin healed, he would have me stand next to him over the kitchen sink pouring normal saline as he worked with the hemostats and worked the fragment out himself. It blew my mind. Not a doctor here, paramedic. We're even worse patients than doctors because we like to think we know what's going on and get no time off to actually be sick. Oftentimes we come to work sicker than most of the people we pick up in our ambulance. We self-diagnose, and if it doesn't require a prescription or surgeon, we make do with the duct tape and NSAIDs. If we do require actual medical intervention, we do all the things we hate when our patients do it to us. We'll tell them where to start IVs. We ask to see imaging and lab results. If there was a way for us to stay awake and assist in our own surgery, we'd do that too. Last time I was getting an IV pre-op, shoulder repair, I was unintentionally telling the nurse where I prefer the IV. The nurse said if I didn't cut it out, she'd find a much less pleasant spot to put the IV. My wife, also a medic, agreed with her and told her to use a much larger needle too. I shut up, LOL. Civilian medics are spoiled, because when I was in the Army, they started us out on each other with 14 gauge needles to learn IV practices. I bet you were hoping for an 18 gauge. My dad is a doctor, and in all my years of living, I cannot remember a single time he'd been really truly sick, other than a baby cold maybe once or twice. He's a big fan of the saying, no bones, as in bones sticking out, no blood, no problem. I asked my friend, whose parents are both doctors. Whilst in theory they could prescribe for each other, they generally just call a colleague and request it. For things that go beyond whatever their specialty is, of course they'll go see someone qualified in that field. My friend will just go to see his parents when he is sick. It was okay for them to write him prescriptions, apparently.